I've been in oncology for 25 years. I worked as a treatment nurse and then went back to school to become a nurse practitioner about 15 years ago. I chose to continue my studies because bedside care matters the most to me, and I felt that deepening my understanding of oncology and nursing could further enhance the patient and family journey. I enjoy program development and was excited when there was an opportunity with head and neck to provide complex patient care. Having a nurse practitioner in this group was new, and I was given the opportunity to follow the surgeons, the radiation team, and patients for several weeks to help me understand where the needs were. I came up with a proposal of how to integrate myself into their care, and I began seeing patients who were receiving both radiation and chemo in a symptom management clinic. I had seen the aggregate data from the Putting Patients First forum and knew people were suffering at home or showing up in the radiation therapy department looking for help. This data, however, was representative of only a small number of patients, and I knew we needed to understand the specifics of their experience better. Historically, the Putting Patients First forum was not used with every patient encounter, and I decided to use it routinely in my own clinic. I was worried that collecting this data might just highlight their suffering, but I knew symptoms could change from day to day, and I needed a consistent way to start those conversations. For most patients, pain and appetite was the starting point to managing their symptoms better. But I also began to see how their inability to sleep or even enjoy their food, combined with the pain, negatively impacted their mental health. I was able to send targeted referrals based on the symptom information I received directly from patients. What was missing was to see the impact these interventions were making. Sometimes it is hard to know what story to look for in pro data. It can be so complicated to interpret, and it can be unclear if we are making things better or simply highlighting how bad the symptoms can be. Currently, the data is highlighting some positive improvements, but it is also demonstrating some areas of concern that weren't clear before. Either way, it has helped me understand my patients better and can be used to improve their symptom management. Working in head and neck cancer has taught me that although patients might suffer, they can still feel supported and cared for when we listen to and acknowledge their experiences.